Right, it is 181 days to the general election. It happens to be on Wednesday, the 9th of February, the last day for those who want to vie for different positions, and they are currently serving at their dockets as civil servants. They are supposed to be resigning. Good evening from whatever part of the country you are watching us from. Welcome so much to News at 9. My name is SHADRACK OGEGA, and of course my sign language interpreter is Felix Otieno. And we want to go straight into the first news of night. And against the wish of many public service who wish to contest in the forthcoming general election to resign, yesterday by the Court of Appeal judgment on Section 43 of the Election Act that stated that the civil servants must do so before today, that is 9th February 2022. So far, we've got Charles Keter, who has resigned as devolution CS and will be seeking to become the governor for Kericho. We also have CS for East Africa Company, that is Aden Mohammed. And also we have John Munyes, who leaves the petroleum docket and hopes to become the next Turkana governor. Meanwhile, also the IEBC has cleared the air whether MCAs who want to vie for MP position are supposed to resign. And in his statement, the MCAs are only supposed to they're not required to resign by close of business today, but instead do so by submitting their Member of Parliament nomination papers to the IEBC in April.
Haja mama hii.
Kuna nani sasa?
Now to some politics, and on the campaign trail, Deputy President William Ruto and his Kenya Kwanza Brigade today toured the Trans Nzoia County, drumming up support for their quest to form government in August 9th. The trio crisscrossed the streets of Trans Nzoia and culminated their campaigns at Kenyatta Stadium in Kitale Town. Take a look.
Nyinyi mnajua nyinyi ni wafuasi wa chama cha Ford Kenya. Na tumekuwa na watu wakatuyumbishwa. Na mimi nikawaambia watajua saizi ndio wanakimbia, kwa kizungu tunasema they are running helter skelter, not knowing where they are going, not knowing where they are coming from, not knowing what is waiting for them ahead. But I told them, every single act you take, there are attendant consequences waiting for you around the corner. Wale marafiki zetu wenye walivuruku chama sasa wamehama, and we want to tell them tutakutana.
Kuna watu wengine wachache ati wanatumiwa ati kutugawanya. Hawa watu wametengenezewa chama. Mimi nauliza nyinyi, mkiona huyu mtu wa kwenu hapa, huyu Eseli na Eugene wanaweza kutengeneza chama? Wako na uwezo ya kutengeneza chama? Hii ni watu wametengenezewa chama, ni kibaraka ya mtu ya kitendawili. Mimi nawauliza hawa wangwana, wacheni ukora. Kama nyinyi ni wanaine kamili, kwendeni ODM, musimame ODM na mtu wenu bwana kitendawili.
We do not want a government run by proxy. We do not want a government run by remote control. We want a government that is hands-on. Watu wanashikilia, wanajua wanaenda wapi. Tunaelewana kabisa.
The three-day health workers conference in Mombasa County that was to review the training needs of health professionals has ended today, with senior ministry officials, trainers and health stakeholders having turns to deliberate on ways to improve the healthcare services in the country. Amongst the goals for the meeting was to understand Africans' opportunities to advance and accelerate cutting-edge health research, improving leadership and governance of the sectors, human resource and trafficking health sector as a priority in setting up 5 years after devolution. Brenda Okello was a part and parcel of the last day of the session, and she has filed this report.
Cabinet Secretary Mutahi Kagwe has today confirmed the closure of the 3 days health workers conference that was officially launched in Mombasa County by President Uhuru Kenyatta.
Those of you who are from outside the continent, we are also glad that you are here with us. We will also be working with you because I spoke about the universality of the human body. Moving forward, we will not be recipients of ideas. We will be a continent that shares ideas because we too know what we want.
The Health Director, Dr. Amoth, presented some of the recommendations provided by the delegates who participated in the Health Workforce Conference, which was focusing on the liberation of the health sector in the country.
Recommendations include development of policy framework for acquisition of competency-based continuous professional development. Number two, introduction and integration of simulation-based approaches in healthcare professional training to enhance teamwork and patient-centered care. Number three is to review the harmonization and enforcement of regulatory frameworks across member states for mutual recognition of healthcare professionals. And number four is the establishment of a legislative and regulatory framework for all unregulated health professionals to be regulated under one umbrella body. And this is key, and KH4 has been working in this space. The health sector is a very dynamic sector. New information come into being, and people, of course, because of demand, will train in those sectors. And without the requisite oversight in terms of checking what they are practicing, then some of the practices could pose a challenge in terms of quality of care and, of course, outright danger to the consumers of that particular service. So it's imperative that we have quite a number of cohorts that are not regulated currently, and we have given that challenge to Dr. Kyoga and KH4 to midwife that process as we look at developing a comprehensive regulatory framework to ensure that there's no particular cadre or group of people who practice and offer services to people who have no oversight.
The Minister of Health, Senator Mutahi Kagwe, said that his ministry is ready to implement the recommendation provided by delegates who participated in the conference. He also urged the education sector, especially those who offer medical training, to adhere to the new revised curriculum which will help revive the health sector.
I have to respond to the requirements of what you have created. You have created a new environment. That means I have to change the way that we do things and the way we structure ourselves. And I want to confirm here and now that that will be done.
Okello Brenda, Boss TV.
Right, thank you so much, Brenda Okello. And now moving on, after President Uhuru Kenyatta commissioned a modern cancer treatment center at Coast General Hospital, patients are now being referred to the hospital for private, have been referred from the public hospital to private hospitals. Clifford Mark caught up with one of the cancer survivors, and she has narrated her story in battling and triumphing against cancer. Take a look.
While opening a modern cancer treatment center for the Coast region through a partnership between the state and counties, the president said the cooperation between two levels of government will help cut infrastructure problems in the sector. One recovered patient narrates how she was diagnosed with breast cancer at stage 2B, and after undergoing the necessary treatment procedures, she survived.
Mimi niligundulika kwamba niko na saratani ya matiti upande wa kushoto. Lakini nashukuru nikisimama hapa, ninasimama nikiwa na ushuhuda ya kwamba nimepona. Kwa hivyo tumaini lipo la wagonjwa wa saratani.
She says that cancer, just like any other disease, can be treated and cured, and demystifies the belief that describes this disease as a killer with no chance of survival.
Ni kufuata ushauri. Mtu aende apimwe, ijulikane ni saratani aina gani, saratani iko stage gani, na aendelee na kufuatilia matibabu. Wazo hili la kwamba saratani ni urogi, ya kwamba saratani haiponi, ukipatwa na saratani ni kana kwamba umepatwa na kifo, ni makosa kabisa. Saratani ni ugonjwa kama ugonjwa mwingine wowote ule. Anayepata saratani sio mwisho wa maisha.
The lady goes on to explain how her body underwent physical changes during treatment and encourages diagnosed people to be brave and that they can fight this disease, warning against the dangers of social stigma and beliefs surrounding it, one being that herbal treatment can cure the disease.
Nywele zilikuwa zimeenda wakati wa kimo ile ya kwanza tu, sikuwa na nywele mahali popote. Lakini saa hii mnaniona, nywele ziko. Kucha zilikuwa ni kama ni gonjwa, zina vidonda, lakini saa hii ziko ni mpya kabisa. Na niko na afya na ninaendelea na shughuli zangu kama kawaida. Lakini ninashauri watu wapimwe. Na mtu anapopimwa mapema hata ni vizuri zaidi.
Cliff Mark, Boss TV.
Na kama huu si uongozi na umoja, sijui ni vipi lingine. And I think more.
Permanent Secretary in the Ministry of Housing and Urban Development, Charles Hinga, has commended the ongoing modern housing project at Buxton area, Mombasa County. Hinga has said despite the project receiving criticism left, right and center, it has become an employment ground for locals in the area. The PS was flanked by the chairman of Buxton Point Apartments, Suleiman Shahbal, and the project chief executive officer, Ahmed Badway, and the project will have 2,000 housing units at a cost of 6 billion Kenya shillings. Take a look.
Speaking during the inspection tour of the Buxton Housing Project, Principal Secretary Charles Hinga says the national government is still conversing with the National Housing Corporation (NHC) and the National Social Security Fund (NSSF) to implement the tenants' purchase to plan for Buxton tenants, while the temporary ones are given priority in the program.
So for me, this is very exciting. I've seen the beauty about tenant purchase scheme and rent to own is that it's a bit more patient than mortgage. But I also have good news that even mortgages, the rates of interest rate, we brought them down to single digit, 9% interest rate, and it is fixed and it is long term. So that has almost halved the repayment. But for tenant, I know there are people who cannot still walk in a bank and get a mortgage. Those are the ones we want to cater for. So first of all, National Housing Corporation, we will partner with you, see how many units we can buy, and then we offer tenant purchase scheme, especially to the wale watu wa chini kabisa.
He also went on to say that more than 3,000 residents have found employment through the project.
This place here, how many number of jobs are we talking about? 3 shifts, almost 3,000 direct and indirect jobs that are here in these almost 14 acres? 12, 14 acres. So can you imagine when we start taking this and scaling in 100 acres, how many people are we going to employ?
According to businessman and the project developer Suleiman Shahbal, the first phase of the project will be officially launched in May this year by the President Uhuru Kenyatta.
Of a very high quality, and what you're going to see here, this is the Mercedes-Benz of affordable housing in Kenya. With all the social amenities, and our philosophy is very simple. We're selling a lifestyle and giving the people of Mombasa an indication or a show of what a new Mombasa should look like.
Reporting for Boss TV, my name is Victoria Ndoro.
The inside part of it is a unit layout, 3 bedrooms, 2 bedroom, and a sample of 1.
Yes. Right, moving on to another interesting story here, quite shocking in the country. And the family of Nasoro Mohammed, a man who was abducted by people who posed to be policemen on 5th of February, now wants the government to intervene and help them find their loved one. Flanked by the family, the Rapid Response Officer for Muhuri, Francis Auma, said that it is quite a trend that unclear disappearance cases have been on the rise in Mombasa at the watch of the government. Anita Auma with the details.
It is alleged that Nasoro Mohammed was arrested by 5 people believed to be police officers at his home in Mtwapa, Kilifi County at around 5 p.m. on Friday before he was kept inside a probox and driven off. Since then, he has not been seen again, something that frightens his family.
Nasikitika sana kusikia kijana wetu wa mwisho anaitwa Nasoro Kijuvi, Hamadi Kijuvi, alipotea siku ya Ijumaa. Alikuja kuchukuliwa ndani ya nyumba na watu ambao inasemekana ni maaskari siku ya Ijumaa saa 11 jioni, na hadi leo hatujajua yuko wapi.
Nasoro ana watoto 7. Watoto wake ni wadogo, 2 ni wakubwa, wako class 8. Tafadhali serikali twaiomba, kama ni polisi wamemchukua wamrudishe tafadhali. Warudishe, manake bibi yake hana kazi. Sasa hivi watoto watesekana chakula, mimi mwenyewe sina kazi. Tafadhali naomba Nasoro mumrudishe. Kama ameuawa pia turudishieni, tuwekeni tu hapo mlangoni tu, tuchukue tuzike maiti yetu.
Following the incident, his family was advised to report to the Mtwapa police station, while their efforts to locate him at various police stations were unsuccessful.
Basi nika-advise familia waende wakapiga ripoti polisi Mtwapa, wakapiga ripoti as a missing person. But hii si kesi ya missing person. Hii ni kesi ya mtu abducted. Mpaka wa leo Nasoro hajaonekana.
Tumetafuta police station zote za hapa Mombasa, za Kwale pamoja na za Kilifi County. Hatujampata.
Francis Ouma, who is a rapid response officer at Muhuri, has condemned the act and said that they will take action to ensure that justice is served.
Na watu wameshuhudia waliokuja kumchukua walijitambulisha kuwa na maofisa wa polisi ATPU. Kwa hivyo tuko na ushahidi wa kutosha kuwa Nasoro amechukuliwa na serikali. Nasoro amechukuliwa na polisi. Amechukuliwa na kitengo cha ATPU through lawyer wake Chacha Mwita. Sisi shirika la Muhuri atakuwa tunabudi hivi sasa bali kwenda kotini na kuhakikisha kuwa tunawaturutisha serikali kumtoa Nasoro, au amekufa au ni mzima. Imekuwa ni trend hapa pwani ya Kenya, hususan Mombasa, watu kupoteza kiolela olela. Maona maiti inapatikana Thika, zinapatikana Nairobi, hata zingine zimepatikana kule Yala. Hii yote tunahakika polisi wanahusika vilivyo. Na kama mtu ana kesi, kama mtu ni mhalifu, kama mtu ana shida yoyote, tuko na mahakama. Kwa nini mumchukue Nasoro na mmempoteza na mpaka waleo familia juu yuko wapi? Serikali wanajua Nasoro yuko wapi na lazima wamproduce. Na somebody must be held responsible on this.
Anita Auma, Boss TV.
Right, of course, that is quite unfortunate. They are reporting from Anita Auma in relation to the disappearance of Nasoro Mohammed.